The strikes affecting our schools and hospitals and rubbish collections have annoyed us all. So has the reporting of them annoyed the strikers themselves. To find out whether they have a case which has gone unheard in the general clamour, we've invited national leaders of the striking unions to meet us. And I have with me Terry Mallinson of the Confederation of Health Service Workers, Bob Jones, National Union of Public Employees, Charlie Donnett, General Municipal Workers Union. And my voice sounds like as if it ought to be your voice, actually, losing my voice from shouting, which I suppose you've all been doing. You say you have been unfairly represented by the media. Is that right?
Yes, we believe quite firmly that we have been, or our members have been misrepresented by the media. And we can take as an example the Queen Elizabeth Hospital for children here in London, where in fact the people who are taking industrial action had been very careful to see that every facility that was available for those children and the care of those children and dealing with the emergencies were laid on for these children, and the staff themselves feel very aggrieved at the type of treatment which they have been getting from the public media.
So whipping us up in an irresponsible way, you're saying?
It's been whipped up in an irresponsible way. The staff feel very peeved at the sort of thing that's going on. The attendance of David Ennells carrying the child in fact created great feeling amongst the membership. And they know full well that such places as Kent Ambulance on the day of the 22nd gave a full day's service free to the public in Kent, and this happened throughout the country. They didn't want to be paid any wages. They provided an emergency service to look after the people of this country because they do care. They really care. And the public media is demonstrating at this point in time that these people don't care, which is a complete misrepresentation of the truth.
Have you got anything to add to that, Bob Jones?
Yes, certainly. I think one of the problems has been the Department of Health's own bulletins, which have indicated so far as the code, that's the code for the care of patients concerned, has not been fully observed. Now, we've complained bitterly to David Ennells about that. There's clear evidence that in over 99.9 cases where there's industrial action going on, that code has been more than observed. And one can give examples. St Andrews at Bow is an example where currently there is industrial action going on, but the level of cover given by the strikers is greater than it's ever been in any other strike that's ever occurred at that hospital, but never, you wouldn't think so from what the media said. Additionally, there's been a great number of emotive pictures on television and pictures in papers, pictures of nurses pushing beds. Now, my organisation and our organisations represent a tremendous number of nurses. Mr. Madison's organisation, mine, between us, probably represents about 2/3 of the nurses. And it's nothing new for nurses to push beds. And unfortunately, it gives the impression to patients' relatives that the patients may not be getting the care. That's completely false. A third point, I think, is that it's noteworthy that 2 major national papers have already apologised publicly to us for misreporting. Unfortunately, once they've done the smear, it takes a hell of a lot
to live it down. Yeah. Can you bring me up to date on what's happening in your strike, Charlie?
Yes, the Prime Minister made a statement, a public statement over the weekend, which seemed to up the ante once again to 10%. It was only a couple of days before that that his ministers were laying down very firmly to the local authority employers, for example, that 8.8 was the furthest they would go. A couple of days later, it's up to 10%. And indeed, it was a significant statement to me because it told the local authority employers that if they want to go beyond 10%, they're free to do so, provided that they find the money out of the rates. Now, this is a very important development because, if you don't mind me saying so, the local authority employers have been sheltering behind the government's guidelines. And now that these guidelines are moving, in my view, this gives the local government employers the opportunity to come forward with a realistic offer.
A lot of people have wondered whether you went too quickly into strike action and that you should have tried other methods like arbitration before you did strike.
Well, that's, if you don't mind me saying so, I think that's quite wrong and quite false. Our operative date for negotiations was the beginning of November, and we were negotiating on this settlement from early September. Now, the action didn't start until nearly the end of January, so nobody can legitimately accuse us of jumping the gun.
No, that's absolutely true.
The same would apply to health service workers. They were due for an increase early in December. The ancillary staffs of the health service were in fact due for an increase 2 months ago. The ambulance staffs in themselves were due for an increase from the 1st of January this year. So we don't believe that we have in fact taken precipitate action. We believe that normally negotiations would have continued and would have been successfully concluded by the dates that the awards were due to be made. But because of the government's rigid 5% pay guideline, there was no way that we could in fact make any progress whatsoever during the period leading up to the dates that the awards should have been made. And therefore we don't believe that our action has been precipitate. We believe that our members and the unions have been exceptionally patient in allowing the government to have sufficient time to review the position on pay.
But Bob Jones, do you think that in any sense at all were you forced to strike by the action, the successful action of strikes in the private sector?
Not necessarily, no. We were forced, I think, to take action because of the fact we could not get a decent pay offer to our own claim. Certainly settlements in other industries affect our members. We are part of society, they see what other people are getting. It affects the general movement of prices, costs, etc. But no, our action is specifically concerning our own claims and our own cases. And a very justifiable case. Our members stood, in terms of 1974, on a basic level of 2/3 of the average earnings. Today, they stand on average about £20 a week less than that. Now, that's because they have not moved in the last 4 years as other people have moved. There have been pay policies the last 4 years. The evidence clearly is private industry doesn't stick to them. And we can't see our people nailed down any longer.
Yes, but Bob, I think it's quite clear that our public servants see that militancy pays in every other field except in government employment. And it's no wonder to me that this is blown up now.
But can I ask you a question, a rather general question about strikes, actually? It's this. Do you feel that the system of striking for pay has become a rather blunt weapon, and the people that most deserve it don't get necessarily the most money?
Yes, that's quite true. People speak in percentage terms, as though equality was being granted to everybody. Now, obviously, when we go into a grocer's shop, we pay the same amount of money for our messages as others, and 5% of £40 is only half of 5% of £80, and so on up the scale. So when people say that they're getting the same percentage increase, that's not equality in any way whatsoever.
Can we analyse the position of strike action? Strike is being used as a terminology within the public media to indicate that the health services and public services are totally on strike. This is completely untrue. There are forms of industrial action which are taking place, which have been deliberately geared to it at management and to create as much disturbance with management without affecting the patients and the public as possible, to encourage management to come to some form of agreement with the unions. So the vast majority of industrial action which is taking place throughout the British Isles, and particularly in the health service, falls far short of strike action. It has been very, very effective indeed, and I believe that this shows the responsibility of the unions concerned in not taking all-out strike. The thought of taking such action is horrific, and therefore the unions have deliberately used tactics which in fact are geared not to affect the patient and not to affect the public. And might I reassure the public of the British Isles, because a lot of the public media statements that have been coming out must have had parents and relatives of these children in Queen Elizabeth and other places where it's sick that their children's lives were in danger. This isn't true. It isn't true for 1 minute. Our members are responsible. Our members do care. They probably care more than most. This is why they're working in the hospital and the public services in some of the jobs that they are doing, which are unpleasant on the low pay that they're doing. So please, let the public of this country be assured that our members will in fact protect the interests of those people who cannot care for themselves.
Thank you very much, gentlemen, for sparing time at this very busy time.